Gentlemen, I need you to stay with me for the next few minutes, because what I'm about to share with you is going to sound unusual at first. You're looking at this video and thinking, Dr. Jocelyn, are you seriously talking about a toothbrush? I understand that reaction completely, but I'm asking you to give me 5 minutes of your genuine attention, because what I'm going to walk you through today is rooted in real human anatomy, specifically in a part of your nervous system that most men have never been told exists, let alone how to support it. This isn't a gimmick. This isn't folklore. This is applied neuroscience, and it begins with understanding how your body actually works, which, in my experience, is something most men never receive a proper explanation of. Not from their GP during a rushed 15-minute appointment, not from the internet, and certainly not from the ads selling them pills with a long list of side effects. My name is Dr. Jocelyn. I've spent the last 12 years in clinical practice working with men on issues of sexual health, pelvic function, and vitality. And in that time, one of the most consistent things I've observed is this: men are not lacking solutions. They are lacking accurate information about their own biology. Once they have that, everything changes. Before we go further, hit subscribe and drop a comment below telling me where in the world you're watching from. I love seeing this global community of men who are choosing to take their health seriously. Now, let's get into the science. Rethinking how erections actually work. Most men, when they think about erectile function, think about one thing: blood flow. And they're not wrong. Blood flow is essential. But here is what most people don't realize. Blood flow to the penis doesn't happen automatically. It doesn't happen passively. It requires a signal, a precise, clear neurological command that originates in the nervous system and travels down the spine to the pelvic region. Think of it this way. You can have a perfectly functional engine with a full tank of fuel. But if the ignition wiring is compromised, if the signal from the key to the engine is weak or interrupted, that car is not going anywhere. For many men, especially over the age of 50 or 60, the issue isn't primarily the fuel, it's the signal. This is the part that most medical consultations skip entirely, because explaining it properly takes more than 15 minutes. So let me give you what I give my patients. The pudendal nerve, the most important structure you've never heard of. Between your scrotum and your anus, there is a region of the body called the perineum. Most men are aware of it in passing, but give it almost no conscious attention. That's a significant oversight, because buried beneath that tissue is one of the most important nerves in the male body, the pudendal nerve. The pudendal nerve is the primary neural pathway connecting your brain to your pelvic floor, your scrotum, and your penis. It is responsible for sensation in the genital region, for coordinating the muscular contractions of the pelvic floor, and critically, for transmitting the neurological signal that initiates erection. When you are sexually stimulated, the pudendal nerve fires a message up the spinal cord to the brain. The brain processes that signal and responds by releasing nitric oxide, which dilates the arteries supplying erectile tissue, allowing blood to fill the corpus cavernosum and produce an erection. That is the circuit. That is the wiring. And when that circuit functions well, everything else tends to follow. Here is the clinical reality I see in my practice every week. As men age, two things happen simultaneously. Circulation becomes less efficient. We know this. But the second factor, which receives far less attention, is what I call neural underactivation. The pudendal nerve, like any neural pathway, becomes less responsive when it isn't regularly stimulated. Sedentary lifestyles, prolonged sitting, chronic pelvic tension, and simply the natural changes of aging can all reduce the nerve's sensitivity and responsiveness over time. The signal doesn't disappear, but it gets quieter. And a quiet signal produces a weak or absent response. This is the underlying mechanism behind many cases of mild to moderate erectile difficulty in otherwise healthy men. And it is largely addressable through targeted sensory stimulation of the perineal region. Why a soft bristled toothbrush? Now we arrive at the part that surprises people. And I want to be clear about what I'm saying here, because precision matters in medicine. I am not claiming that a toothbrush is a cure for erectile dysfunction. If you have significant vascular disease, diabetes-related nerve damage, or a hormonal condition, those require proper clinical evaluation and treatment. What I am describing is a self-administered sensory stimulation technique designed to activate the pudendal nerve pathway in men who have mild to moderate neural underactivation, which, based on what I see clinically, is far more common than most people realize. So why a soft bristled toothbrush specifically? Because the challenge with self-administering perineal stimulation is precision and consistency of texture. Fingertips apply pressure that is often too broad and too variable. The fine, evenly spaced bristles of a soft toothbrush create a consistent, textured contact that can deliver gentle, repetitive sensory input to the perineal skin. The kind of input that research on peripheral nerve stimulation suggests can help restore responsiveness in underactivated sensory pathways. It's a practical, accessible tool for something that would otherwise require specialized equipment. But, and I cannot stress this enough, technique matters enormously. Done incorrectly, this produces no benefit. Done aggressively, it can cause irritation that actively works against the outcome you want. So let me walk you through exactly what not to do, and then exactly what to do. 4 mistakes that undermine this technique. Mistake 4, applying too much pressure. The perineal skin is thin and sensitive. The pudendal nerve sits close to the surface. If you press hard or scrub aggressively, you activate pain receptors, not sensory pleasure pathways. Your nervous system interprets this as a threat and responds by constricting blood vessels. That is the physiological opposite of what we're trying to achieve. Gentle contact only. Mistake 3, using a firm or medium bristle toothbrush. The perineal skin is significantly thinner and more sensitive than the skin on your hands or your back. Firm bristles will cause irritation rather than stimulation. Irritation triggers a stress response in the nervous system. The sympathetic system activates, cortisol rises, and the parasympathetic response we need for erectile function is suppressed. You need a soft or extra soft bristle toothbrush. This is non-negotiable. Mistake 2, stimulating for too long. Nerve pathways habituate to sustained, repetitive stimuli. If you continue stimulation beyond 30 to 45 seconds, the nerve essentially stops registering the input. It becomes background noise. The goal here is a short, potent burst of sensory activation, not prolonged contact. 20 to 30 seconds is the optimal window. Mistake 1, being in a state of psychological stress. This is the most critical factor and the one most men overlook entirely. The male erectile response is governed by the parasympathetic nervous system, the branch of your autonomic nervous system responsible for rest, digestion, and sexual arousal. Stress, anxiety, and mental preoccupation activate the sympathetic nervous system, fight or flight mode. When your brain is flooded with cortisol and adrenaline, blood is directed away from the pelvis and toward the large muscle groups. No amount of physical stimulation will override an activated stress response. You must be mentally calm and present for this technique to work. The protocol, step by step. Here is the precise approach I walk my patients through. Read this carefully before you attempt it, so the execution is correct from the start. Step 1, environment and position. Choose a private, comfortable setting. You can stand or sit on the edge of a chair or closed toilet seat. The goal is relaxed access to the perineal region. Take 60 seconds before you begin to simply breathe slowly and release physical tension from your shoulders, jaw, and hips. Step 2, locate the target area. Using your hand first, no toothbrush yet, identify the perineum. It is the soft bridge of tissue between the base of the scrotum and the anus. It is roughly the size of a large coin. This is the region directly overlying the pudendal nerve's most superficial and accessible point. Step 3, initial contact. Take a clean, dry, soft bristled toothbrush. Place the bristles gently against the perineal skin. Do not press. Simply allow the bristles to rest in contact with the skin, so you feel the texture but no pressure. Step 4, the movement pattern. Use 2 alternating motions. First, small, slow circular movements, approximately the diameter of a coin, with the lightest possible touch. Second, gentle vertical tapping of the bristles against the skin. Alternate between these 2. 5 seconds of slow circles, 5 seconds of gentle tapping. The alternation prevents neural habituation and keeps the sensory signal varied and engaging. Step 5, duration and timing. Count to 30. That is your complete session. This technique is most effective when used as a priming tool, 2 to 5 minutes before intimacy. It is designed to warm up the neural pathway, not to replace foreplay or arousal. Used as a primer, it can meaningfully reduce the latency and improve the quality of the erectile response in men with mild to moderate neural underactivation. The breathing component, why it doubles the effect. Here is the element that transforms this from a simple sensory technique into a genuinely powerful clinical intervention. While you perform the 30-second stimulation, I want you to practice diaphragmatic breathing simultaneously. Inhale slowly through your nose for a count of 4, breathing into your belly, not your chest. Hold gently for a count of 2. Exhale slowly through your mouth for a count of 4. Why does this matter so much? Because controlled diaphragmatic breathing directly activates the vagus nerve, which is the primary driver of parasympathetic nervous system activity. Within 4 to 6 breath cycles, measurable shifts occur in your autonomic nervous system state. Cortisol levels drop, adrenaline decreases, blood vessels in the pelvic region begin to dilate, and the brain becomes more receptive to sexual signals. By combining perineal nerve stimulation with intentional parasympathetic activation through breathing, you are addressing the problem from 2 directions at once. The physical stimulation wakes up the pudendal nerve pathway. The breathing creates the neurological environment in which the brain can actually receive and respond to that signal. Together, they work in a way that neither does as effectively alone. A moment of honest clinical perspective. I want to pause here and speak to you directly, not just as a clinician, but as someone who has sat across from thousands of men in a consultation room and watched them struggle to articulate something deeply personal. Erectile difficulty carries a weight that goes beyond the physical. In my 12 years of practice, I have seen men, strong, accomplished, resilient men, become visibly diminished by this experience. Not because of what it means physically, but because of what they believe it means about them as men. That they are failing, that they are less, that their body has turned against them. I want to address that directly because it matters clinically as much as it matters personally. The psychological burden of sexual performance anxiety is itself a significant driver of erectile dysfunction. The shame, the anticipatory worry, the avoidance, these activate the very stress response that physiologically prevents erection. It becomes self-reinforcing, and breaking that cycle requires both physiological tools and a shift in perspective. Your body is not broken. It is aging, yes, but aging is not failure. It is a change in operating conditions that calls for a more informed, more intentional approach to how you support your body's systems. That is not weakness. That is intelligence. Every man who walks into my practice and says, "I want to understand what's happening and address it," is already doing something most men never do. He is choosing to engage rather than retreat. Sexual health is not a luxury. It is connected to cardiovascular health, mental health, relationship quality, and overall quality of life. You deserve to take it seriously. And there is no shame whatsoever in using evidence-informed tools, whether that's lifestyle modification, targeted supplementation, pelvic floor therapy, or yes, a technique involving a soft bristled toothbrush to support a system that needs a little more input than it used to. Important clinical notes before you try this. Because I am a physician and responsible communication is part of that role, I want to be clear about the appropriate context for this technique. This approach is suitable for men experiencing mild to moderate erectile difficulty associated with reduced sensitivity, pelvic floor underactivation, or psychogenic factors. It is a complementary self-care technique, not a replacement for medical evaluation. If your erectile difficulties are severe, sudden in onset, or accompanied by other symptoms such as pain, numbness, urinary changes, or cardiovascular symptoms, please see a urologist or your primary care physician. These can be signs of conditions, including vascular disease, neurological disorders, or hormonal imbalances that require proper diagnosis and treatment. If you have not had a basic men's health screening in the past year and you are over 50, please schedule one. Erectile function is often an early indicator of cardiovascular health, and a physician who dismisses it as just aging is not giving you complete care. Your next step. Tonight, if you have a soft bristled toothbrush, you have everything you need to try this. Take the time to read through the protocol once more. Set up a calm, private environment. Practice the breathing pattern first. 4 counts in, 2 hold, 4 out, until it feels natural. Then combine it with the gentle perineal stimulation as described. Most men report a noticeable warmth, a tingling sensation, or early signs of arousal within the 30-second window. That is your pudendal nerve responding. That is the signal getting through. That is your body demonstrating that the pathway is still there. It just needed a clearer input. If it works for you, come back to the comments and share your experience. Not for me. For the men reading those comments who are struggling silently and need to know that something this simple and accessible can make a real difference. Your willingness to share removes stigma, and removing stigma saves men's health. If this video gave you something useful, a new understanding of your own biology, a practical tool, or simply the reassurance that you are not alone in this, please hit like and subscribe. I cover men's health topics with the same directness and clinical precision every week, because these are conversations that matter and that don't happen often enough. I'm Dr. Jocelyn. Thank you for trusting me with your time and your health. Take care of yourselves, and I'll see you in the next one.